Good afternoon, everybody. Thanks for joining us today for a special webinar program about COVID-19, of course. That's what everybody's talking about and thinking about still several months into our pandemic. Today is going to be a very interesting discussion. I think many of you, I recognize your names, joining us from our regular monthly OSHA webinar series. We have a special guest today from a technology company that we've done work with or we've shared clients with during this pandemic to help find solutions to this crisis, managing this crisis in the workplace. Our program today is Technology Solutions for Complying with COVID-19 Requirements. My name is Eurek Conn. I am the chair of the OSHA practice group at Conn, Maciel, Carey, and I've been practicing in this field exclusively for 20 years. My first 11 years, I practiced alongside the first general counsel of the OSH Review Commission and set about, at that point, to start my own practice. And 6 years ago, in fact, 6 years ago, just last week, we celebrated the anniversary of Conn Maciel Carey, a firm that we started to focus on workplace safety and health law issues and labor and employment law issues. We work with employers all across the country and across all industries to manage the workplace safety regulatory issues, getting involved in inspections, investigations, and enforcement actions involving OSHA, the state plan, OSH states, and the other alphabet soup of agencies that get involved in worker safety issues and work proactively. And really over the last, last 8 or 9 months or so, mostly working proactively with our clients to manage workplace safety and health, regulatory compliance, and just general safety and health issues. And that's been working with our clients to develop written infection control plans and strategies and to deal with the barrage of employee complaints and interactions with OSHA and the state OSH plans for dealing with this. I co-chair Conn Maciel Carey's COVID-19 task force. I've had the pleasure over the last few months to work with a tech company called Maptician, who has developed some really interesting solutions for some of my clients and many other employers around the country for dealing with infection control strategies. And I'm very pleased to be joined by a guest speaker today, Eurek. Nick, why don't you introduce yourself and tell everybody a little bit about Maptician?
Sure, thank you. Appreciate the introduction. So my name is Eurek. I'm one of the co-founders of Maptician, and a little bit of background. So I've got a bit of an unusual mix of engineering and law. So certainly not nearly the law background that Eurek has, but enough typically to be dangerous. So started with the software industry about 15 years ago, primarily with a company called Expansion, and I was ultimately CFO there, and took my leave back in 2015, and a couple years later co-founded Maptician. And Maptician was originally, or still is, but the primary goal of Maptician was generally as a workplace analytics and management platform. So built around something of a smart map technology. We've been operating for past few years, and really this year with kind of the advent of the COVID-19 situation, we found that the tool that we had built actually works very well for some of the planning and analysis and operational response that organizations need to take to plan their back to office and manage from there. So we've been working with dozens of clients since the start of the crisis, and we think we've made a good difference in their approach, and hopefully made their office environment safer all around.
So today's program is going to be a combination of sort of a regulatory review. What is it that these OSH agencies, federal OSHA and the state OSH plans, expect from employers in terms of infection control strategies, the engineering controls, administrative controls, safe work practices, PPE, and the like, to address this brand new hazard that has infiltrated our workplaces, the COVID-19 virus. And we'll go back and forth. I'll talk a little bit about what the regulatory requirement is, and Nick will talk about some of the technology solutions that Maptician has developed and is developing hand in hand with employers around the country to implement some of those controls, to design and implement the engineering solutions to help manage the administrative controls, the procedures and policies that have been successful in reducing exposures in the workplace and demonstrating compliance, right? A big part of you, if you followed our webinar series and interacted with us about how to manage OSHA regulatory compliance issues over the years, one of the things you've heard me say probably a bunch of times is if it's not written down, it didn't happen. And you can have all the best infection control ideas in the world, and that probably will have a good real effect on managing spread of the virus in the workplace. But now we've got these regulatory agencies really digging in and enforcing recommendations, enforcing requirements, developing new standards. So having written infection control plans and having real, technology solutions where you can run reports and show a visualization of the way you have implemented infection control strategies, you're going to better manage the pandemic in your workplace and also better manage your interactions with the regulatory agencies. So we're going to talk mostly from the vantage point of the Virginia OSHA standard, because that was the first in the nation emergency temporary standard. But really the concepts that we're going to talk about today apply all across the nation. We know OSHA is looking to enforce these same issues through the general duty clause. Other states are doing the same. Other states are developing their own emergency standards. Other states are enforcing governor's executive orders and health department orders and recommendations through their general duty clause or safety and health management system requirements. So it'll be an interesting discussion about the hazard assessment concept, the engineering control concept, and the administrative control concept for how to carry out the requirements that state and federal OSHA agencies are expecting you to do. So let's dig right into that. So as a starting point, we'll talk a little bit about the regulatory requirements for managing COVID-19 spread in the workplace. And the first place that we would start with is OSHA. How is OSHA tackling this? And OSHA's approach from the beginning, which I think has been an appropriate and successful one, has been to focus on developing really effective guidance, right? This is a brand new novel virus. It is different in many ways from the cold and flu. It is different in many ways from H1N1 and prior pandemics. And the reaction of employers, the infection control strategies of employers consequently is also different. So OSHA has issued numerous pieces of guidance, some that apply broadly to all employers, some that apply specific to different industries, and really spent the first couple of months of the pandemic educating employers and putting out guidance and helping them understand how the virus spreads and actions that employers can take to stop that. Then we move into the enforcement stage. OSHA's view of this has been, we don't need a COVID-19 specific standard to enforce this. We have a portfolio of standards that generally apply to some of the strategies, right? PPE standard, sanitation standard, hazard communication standard about new chemicals that might be introduced into the workplace. So we've got specific standards already that employers, if they're following them, will be developing effective infection control strategies. And of course, OSHA has its general duty clause. And really, the general duty clause, I think, is designed for situations like this, a brand new hazard that hasn't existed before. So this is not a failure by OSHA to undertake rulemaking over the last several decades to address this, because it's brand new and it's unique, and the contours of how you effectively manage it are different and unique. So it makes sense to rely on that backstop of the general duty clause to enforce it by issuing good, smart guidance, looking to the scientific community like the CDC and others for how to effectively respond to this, and then enforce it for those employers who truly ignore the science, ignore the guidance, and do nothing to address the spread of the virus in the workplace. Well, there's a recognized hazard here. There's recognized control measures you can implement. And if you're not doing that, it's an easy target for the general duty clause. There has been backlash that OSHA has faced for that approach. The big national unions, the Democrats in Congress, the media have blasted OSHA for supposedly sitting on the sidelines, burying their heads in the sand, letting employers run amok during this pandemic. I disagree. That's not been my view of what OSHA has been doing, but that has been the approach. A lot of pressure for OSHA, Fed OSHA, to develop a COVID-19 specific standard. To date, they've not done that. But on the next slide, we'll see that some of these state OSH plans have started to fill the gap, the supposed gap, where Fed OSHA has not implemented a specific standard. Virginia Governor Ralph Northam, a Democratic governor in a Democratic state now, says that workers should not have to sacrifice their health and safety to earn a living, especially during a global pandemic. In the face of what Governor Northam says is federal inaction, Virginia has stepped up to protect workers from COVID-19, creating the nation's first enforceable workplace safety requirements. Now, I disagree that it's the first enforceable COVID-19 related requirements, but it is the first COVID-19 specific standard, right? Like a lockout tagout rule or a machine guarding rule. There is a specific rule in Virginia that has specific elements that Virginia employers need to follow. Now, the elements of the Virginia rule, I think we get to on the next slide, you'll see are not terribly different than the guidance that Fed OSHA has been issuing since the beginning, not terribly different from the guidance that CDC has been issuing. In fact, part of the Virginia rule says if you are following CDC guidance that is at least as effective as the Virginia rule, and essentially it's always going to be the case because the Virginia rule maps at least what was CDC guidance when Virginia promulgated the rule, that's tantamount to compliance. So the fact that Virginia has this specific standard is great. I think that's a useful tool for Virginia. It gives clarity to Virginia employers, and it probably makes Virginia's job, the government's job, easier to enforce the requirements, but it doesn't actually really create unique requirements because it really is just an enforcement tool for what was already existing guidance that frankly was already enforceable under the general duty clause and related standards in the states. But effective July 27th, Virginia has this new rule. One thing that people don't know, and this is just something to pay attention to from a timing standpoint, the day that the Virginia Emergency Temporary Standard went into effect, July 27th, that rule also acted as notice to employers in Virginia of Virginia OSHA's intent to develop a permanent infectious disease standard. And the initial proposed rule for the permanent standard is the emergency temporary standard. Now, this would not be a COVID-19 specific rule, but an infectious disease standard generally, which would live long past the end of this pandemic, which we all hope is coming very soon. But the idea would be that some of the requirements we're talking about here would be permanent requirements to assess the hazard of potential infectious disease exposure in the workplace and implementing infectious disease preparedness planning and training, et cetera, for any infectious disease that might be relevant in your workplace. In any event, VOSH has adopted this rule. We know that other states are following soon. Oregon, I think, is within 2 weeks of finalizing its own emergency temporary standard. California is a week or two away from voting on whether it will implement its own emergency temporary standard, and notwithstanding the fact that the Cal OSHA division, the entity that is Cal OSHA enforcement, has recommended against it, arguing the same that Fed OSHA has, is that we have all the tools we need already to enforce good infection control. The Cal OSHA Standards Board has signaled a strong likelihood that they will also adopt a rule. Other state plans are considering it, and regardless of the development of these standards, we know that there is very active enforcement already underway all around the country in enforcing governor's orders, enforcing health department orders, enforcing CDC and OSHA guidance. And I've listed a couple states here where we're already seeing those citations coming in Michigan OSHA, in New Mexico, in California, Oregon, and Washington, to name a few. And by the way, we're not really out of the woods yet in terms of Fed OSHA issuing its own emergency temporary standard for COVID-19. There is always the possibility that Congress brokers some sort of deal. We know Mitch McConnell is very interested in liability relief for employers, and the Democrats in Congress are very interested in a federal OSHA emergency temporary standard. I could easily see those part of a horse trading exercise where we end up, even during a Trump administration, with OSHA were being required to implement an emergency temporary standard. And I have heard specifically the Biden campaign saying that one of the very first things that a President Biden would do is to implement a COVID-19 emergency temporary standard. So there is still the likelihood that we see this all across the nation. And what this is a regulation that requires employers to assess and categorize the potential exposures to COVID-19 in the workplace, and then to implement an exposure control and response plan to deal with that. So doing the hazard assessment, what is required? This is sort of geared off of our discussion today, geared off of the VOSH rule, but again, it applies essentially everywhere in the country. One of the first things OSHA did back in, it was either February or March, was the guidance that OSHA issued on preparing your workplace for addressing COVID-19, and they talked about doing this hazard assessment. VOSH has talked about a requirement to go job task by job task, or groups, similar groups of job tasks, and assessing whether there is potential exposure to COVID-19. And that means, are there potential close contacts, either with the public or other coworkers? Are there workstations that are too close together? Are there times of the day or events during the day that compress a great number of people into certain areas of the workplace? And to evaluate those working distances and times and activities, duration and frequency of exposures, and where and how those hazards might be encountered in the workplace, and to categorize them. On the next slide, we talk about these 4 categories that VOSH has laid out. It's the same 4 categories that OSHA has talked about from the beginning of the pandemic. Very high risk and high risk exposures. Those are really limited to the medical industries, healthcare, emergency responders, transport for ambulance services and first aid and emergency response services, and other medical professionals where you are interacting with known or potential COVID positive patients or residents. And for very high risk, it's engaging or being present for aerosol generating procedures. For high risk, it's just being present and interacting and working with those known or suspected cases. Then we drop down to the medium risk category, which is going to be a great deal many more employers and workplaces in this medium risk category. And it's not by, again, it's not by a workplace, it's by job task within the workplace. You might have a limited number of job tasks in the medium category and most in the lower risk category. But medium risk means that there are job tasks that require more than minimal occupational contact with a coworker or a member of the public who is a potential COVID-19 positive individual. And potential could mean literally anyone, right? It's an invisible virus. There are many asymptomatic or very mild symptomatic, potentially contagious individuals. So anyone, and literally any individual, is a potential COVID positive individual. And if you have more than minimal occupational contact with, that's inside of 6 feet, interactions with anyone who is a potential COVID positive individual, that would be a medium risk category job task, unless you take certain actions to get to lower. And the lower category is the last item here, and that's where you have either no requirement to have contact inside of 6 feet with any other individuals, or minimal occupational contact, passing in the hallways, working outdoors with very, very short interactions. And that's where the task is either that way and has always been that way, or that you can take steps to achieve that minimal occupational contact. And VOSH recognizes, and OSHA recognizes, this concept of getting to lower. And that's where a tool, or the set of tools that Maptician has developed, has been really interesting to watch how some of my clients have utilized that to conduct the essential hazard assessment, the required assessment itself, using the tool to identify where those exposures might occur, and then using the tool to relegate out some of those contacts and help get to lower. And I'm going to turn it over to Nick here to talk about and demonstrate how their tool has been useful in that regard.
Sure, thank you. So probably the first thing that you'll notice is a sort of a very busy map over on the right side of the screen. So this is a screenshot of a kind of a typical, in this instance, a software company with some pretty high density seating for software developers, testers, things like that. So as Eric said, sort of the first step in the OSHA analysis is really to take a look at, where are you currently? What does your office currently look like, and where are some of those risks for exposure levels, and by task or by job category, where do you fall along those lines? Is it high, medium, low? And then once you find that out, as Eric said, what steps, if you are above that lower threshold, what steps can you take to reduce that exposure risk and get down to that lower threshold where some of the other requirements under the regulation become a little bit less onerous, and in addition to just simply reducing the overall risk for the employees. So our first step in basically creating a bit of a digital risk or risk assessment approach is to map out the existing office space, and we've been able to do that from CAD files, from PDFs, occasionally even some well-drawn, hand-drawn type documents, but basically we're able to get the maps as accurate as the source document. And so based off of that, we're able to allow employers to sort of give us information as to where their current employees are sitting, how far apart they are, and so we're able to help them establish what are those distances between employees, how many people are they putting in a given space, and based off of that, what's the density look like? A little bit of what does the overall work environment look like in terms of what types of tasks are being performed in certain areas. Is it customer facing? Is it retail? Is it general office work, manufacturing? Any of those types of things all have different risk characteristics. And so once again, the step one is just simply to say, where are the risks for our current office space? From there, we have a number of tools available to help address some of those risks that are outlined by that process. And sort of the two main ones is the engineering type approach, and that is, okay, can you reconfigure your office or reconfigure your workspace to separate people out with a minimum of 6-foot distances? And so, for some offices or some workplaces, this may be a relatively easy task. Other ones, just based on density or the nature of the work, that may just not be viable. And that brings us to the next primary approach, and that is staggering work shifts. And staggering could mean either on a sort of a predefined, very structured manner, or staggering in a bit of an employee self-service. People can come into the office up to a point and within certain constraints, so that when they're in the office, that they are not in violation of some of these policies that are put in place. And so that would fall under those administrative processes that could be used to reduce those outlined exposure risks. And then beyond that, there's a few other ones. The ability to communicate to employees and to post information about what resources are available. That may be PPE equipment, it may be hand sanitizer, it may be sanitizing wipes, whatever the case may be. This gives them a way to quickly find out where those resources are and make sure that people have access to them. And then the last one for this slide is one we don't see used too often, but it's mentioned a good bit, and perhaps as this process continues, we'll see a little bit more, and that's floor-to-ceiling barriers. We've heard a lot about plexiglass being installed between, say, customer service representatives or people in kind of high-density offices, and at least according to the Virginia standard, kind of a half-height plexiglass barrier doesn't really cut it. They require a floor-to-ceiling impermeable barrier for that to be considered sufficiently distanced. So, like I said, we've not seen that really so far, but we'll see how that wraps up going forward. So I talked a little bit about, okay, from your current state of your workplace, where are those risk areas? And here you can see a bit of a social distancing analysis that we can perform with the application very quickly, just a kind of a 2-second configuration to set, and you'll see that we have a 6-foot sort of social distancing radius around employees. And if people are too close to one another, or at least the seats are too close to one another, you'll see that they turn red and sort of indicate that is a potential source of risk. And one thing that you'll notice a little bit here is in private offices, you see those social distancing rings getting cut off by the walls. And that's similar to that floor to ceiling barrier that we talked about before. According to the regulation, any walls, windows, anything like that that's floor to ceiling is considered to be sort of de facto socially distanced. So someone could be directly 2 feet away from someone else, but if there is a wall in between them, it's considered to be within reason, not a exposure risk. So you can see that the system understands, hey, if someone is separated by a wall or a window or any other architectural type object, not to flag them as a potential risk source. And so I talked a little bit about the office type environments, but we've also done educational institutions. We have a partnership with the University of Nebraska. So we have mapped out all of the University of Nebraska at Carey facilities and helped to plan their social distancing. We've also done a handful of clinics and medical facilities to help with patient waiting rooms, with patient care rooms, thoroughfare analysis. So some of those types of activities we've been able to facilitate with Maptician. So really there's very little hard and fast limitations on the types of workplaces that we can sort of help analyze and help facilitate the operations of. And here I'm actually going to move over to a live environment and give a, a bit of a demonstration of the seat, the employee staggering, and some of those tools that we can use to help essentially decrease the effective density of an office. So if you've got 200 people sitting in a office building or a workplace, how do you reduce that to maybe 50 or 75 coming in, and that being your peak capacity during this process, or increasing that as hopefully the risk level decreases over time. So this is a dashboard view of Maptician, and you can see a bit of a thumbnail of a typical office environment. And we're going to zoom in real quick. And here you'll see just seats and kind of an overall floor plan. So this is live data. It's tied to employee databases, it's tied to reservation systems, but you can click around and get some context information as to who people are, and in particular here, what schedule is a person going to be on. So I clicked on Ava here, and her schedule is 1 week alternating. So clicking on that, we can see that she is set to show up every Tuesday and Thursday on an ongoing basis. And for Monday, Wednesday, Friday, her seat would be vacant. And you can see that we've got something of a checkerboard pattern going on here. And this is kind of typical on what we've seen with our clients about how they try to socially distance their employees and make sure that you don't have any pockets of density, or at least you try to avoid that as much as possible. So right now she is sort of, at least as far as adjacent offices, bordered by 2 empty seats. Now, one of the things that we can do is kind of time travel a bit. And so we're going to go to our time tab, and we are currently in, right now, September 8th at 1:30 PM mode, and we'll skip forward one day. And now you see that Ava's seat is unoccupied, and her two neighbors are now in the office. So right now we're saying what something would look like tomorrow with this this staggered schedule approach, and we can click on them and get some information about that, or we can actually even find people through the search functionality. Once again, let's use Ava as our example. Zoom to her location, get some information about when she'll be in the office. So the benefit of the, and we call this flex seat type approach, is it's structured, it's predictable, it allows organizations to know, essentially their maximum capacity, lets them know who's going to be in office at the same time, and allows them to have a pretty high degree of control as to how some of those recurring schedules work. And we have almost infinite number of different ways we can set up those schedules, and so you can have multiple different shift approaches going on simultaneously. So for instance, across the hallway here, Carl is on a 1 week on, 1 week off rotation. So there's a lot of different approaches there, but it really depends on each individual company and what they're trying to achieve. So that is sort of the structured, socially distanced through administrative process means. And then there's a sort of more of an employee self-service approach. And we'll move over to sort of the other side of the office, and you'll see this block of cubicle workstations with kind of a green tint to them, and their status set as available. And so Maptician has a built-in reservation system, and so employees through their mobile device or through the web interface here can go in, find availability by day. Hey, I need to go into the office on Thursday morning. And so they can go in, either just do a quick reserve for today, and you'll see, now I've reserved this seat for myself for the rest of the day. And I've got a social distancing ring that basically says, to a degree, people, please don't reserve a seat within that. And if someone did, at least right now, it would show up as a violation. So say, this is an unsafe reservation, and someone would know to go in and delete it, and maybe reserve something a little bit further away. And so we've seen a couple different approaches there. Some organizations sort of pre-socially distance the reservable workstations. And so you may not even have these center ones. You may just simply have, maybe the four corners here as probably being the safe seats from a distancing perspective. Or once again, they allow people to reserve back into their own seats, perhaps even at times making an entire workplace reservable, and just telling people, be aware when you reserve, and who's around you. And so there's a lot of different ways you can approach that, but the end result being you're trying to decrease that density and trying to establish that people have sufficient distance around them, that they're not at high risk. And once again, we're trying to get to that lower risk category here, and so part of that is ensuring that they don't have significant exposure within 6 feet. So let me go out of that for a second and switch back to the presentation. Get some videos here. So effective infection control and response plans. Eric, I think you're going to. Yeah.
So we, I think we've already started to get into some of those infection control strategies in the concept of getting to lower in the process of doing your hazard assessments to comply with the VOSH emergency temporary standard. But the takeaway from that step one, doing the hazard assessment, is that if you end up with job tasks that are identified as very high risk, or medium risk, you are required under the VOSH emergency temporary standard to develop a written infection control and response plan. They give it a different name. It's an infectious disease preparedness plan or something like that, but it's all the same thing. An exposure control plan, infection control plan. You need to have a written plan in place for how you will manage those medium risk or high risk or very high risk exposures in the workplace. An interesting thing from a discussion I had with some of my contacts at VOSH is that the rule requires, and VOSH's expectation is, that every employer, regardless of their hazard risk category, is required to have an infection control plan. It's just that for medium and higher risk workplaces, that plan has to be reduced to writing. But again, if it's not written, how do you demonstrate to VOSH sufficiently that you do have and have been implementing infection control strategies? So essentially everyone is required to have a written infection control plan. And so what is in that plan? That is the collection of your engineering controls that you've considered and implemented, your administrative controls, and your safe work practices that will eliminate, reduce, or address the exposures to the virus in the workplace. And the most popular of those, we tend to break down our infection control plan into things like social distancing and physical distancing. So what we're going to do now is walk through major elements of an infection control plan that are required in Virginia and expected essentially everywhere else. There's already, I saw one question during today's webinar, does OSHA require employers to have an infection control plan? The answer is a little squishy because there is not a regulatory requirement, a standard that federal OSHA would point to and say, you're required right here to have a written infection control plan. But the reality is that OSHA is going to be looking at its guidance, CDC guidance, health department guidance, governor's executive orders, and things like that to develop general duty clause violations. So one of the things that essentially everybody is recommending is developing and implementing infection control plans. I think it's going to be a little bit more like the VOSH lower risk category requirement. So OSHA will expect and will enforce and will require that you have an infection control plan, not necessarily in writing, but at least that you are implementing recognized feasible means to abate this new virus hazard in your workplace. And again, how do you demonstrate that you've done that if you don't have a written plan? So my view, my recommendation to essentially every employer in the country that has employees reporting to a brick and mortar workplace would be to develop and implement a written plan. At the very least, you're going to need to develop and implement these strategies that we're about to talk about. The first major category in every infection control plan that we've worked on, that we've seen recommended, that we know is required by VOSH and others, is social distancing or physical distancing in the workplace. And that is a collection of, that's sort of a principle or a concept that is a collection of several different types of actions, engineering controls, physical changes in the workplace, literally moving or relocating workstations or machines or equipment so that you are separated far enough that you have this distancing to protect you from transmitting the virus from one person to another. Or administrative controls like policies and procedures. Nick talked about scheduling tools, staggering start and end times, staggering break times, cohorting, using things like signage. You know, you've seen, I'm sure, if you've been outside your house in the last few months, seen markings on the floor to designate where, you know, if I stand here, what is 6 feet in front of me if I'm waiting in line behind somebody, to make sure I've kept that distancing. Doing that throughout the workplace where it is common that multiple employees might be present, to show them what would be proper distancing. Floor markings, communications like training events, to educate people about the importance of social distancing, how to do it from an operational standpoint. And then having, I use sort of the elementary school term, hall monitors, but basically having a monitor or person or persons whose job it is to look out for breakdowns of physical distancing and encourage or require that employees and visitors maintain that distancing wherever feasible. The physical changes to the workplace we talked about, reconfiguring break rooms, adding new areas to serve as break rooms, designating flows of traffic in your workplace, either with drawings on the floor or with a map that employees can be trained on, one-way paths down certain areas. Probably have seen this in grocery stores. The same works in office workplaces and manufacturing settings. So that's the major concept of social distancing. Nick's going to talk a little bit about how their tool can be useful to help implement that in the workplace.
All right. Thanks, Eurek. Actually, one of the things I probably should have mentioned earlier, and especially in light of some of the evidence gathering, or at least the documentation side of all of this, is essentially everything that is done within Maptician is all recorded. It's traceable. It creates a record that someone can go back to and say, at this date, what was configuration, who was there, and so it gives the ability to not only demonstrate what precautions were taken, but also allows you to go back and say if there was ever any questions as to what precautions were taken or what something looked like at a given date and time. It's always possible to go back and pull up that information and pull up those versions, and being able to show that as a bit of a digital plan or digital record of those types of actions. Here we can actually see Maptician used as a little bit of a visual cue tool. So one of the principles of the tool is all employees would have access primarily through their mobile device. So they'd be able to bring up any of these live maps on their cell phone or a tablet or on a desktop computer. And so they would gain access to some of this information that could be presented both on site in terms of floor stickers or posted maps, but also from a live, constantly updated, perhaps even a little bit more detailed type approach. So they could get information as to locations of resources, on cleaning schedules, on directional flows of hallways, on even information about here is how a break room or a common room ought to be used, and its capacity levels there. So there's beyond just showing where people are or where a room is, there's a lot of context and a lot of information that can be added to one of our floor plans to kind of give people a good operational sense of how do you use the office and how do you work in this environment in a safe manner and within policy constraints. Parts of that include we do have a large number, and this is just a sampling, but a large number of points of interest that we can add to the maps. These are all searchable, typically have a lot of additional data that can be added to them. It may be schedules, descriptions, additional information, timeframes, phone numbers, almost you name it. But this can give employees that additional context to their workplace. In addition to that, we have a contextual bulletin tool. So on their cell phone or on the web, they can pull up information that is specific to their office, specific to their department, to their role. Basically, it gives a way for the organization to pass typically facility and administrative information to employees in a kind of a consistent time-boxed manner. So we've seen that for training, for announcements, for policy advertisements to employees to say, here is how we're approaching distancing, or how you'd have to self-clean after you use a break room. All those types of things can be essentially posted to employees for them to have access there, and makes for a pretty convenient source for them. Talking about break rooms, as based on the Virginia requirement, there's a number of approaches that you'd have to, a number of requirements that you'd have to meet before opening up a common room or a break room or cafeteria. Essentially, you have to identify what its maximum capacity is based on the social distancing guidelines and the overall size and flow of the space. You have to have that information posted somewhere. I believe it actually says outside of the break room itself or outside of the common room itself. And Maptician actually allows for very convenient printing of high quality maps from the system. So a organization can easily find the break room, add those annotations, add the information about capacity, and then print that out, post it next to the door. And then there's also the requirement, not just that you have the capacity and the distancing, but very specifically that those items are enforced. So it's, I think to my knowledge, the only area that almost reinforces that, that concept of you not only have to have the policy and make it something of a fair, good faith effort of enforcement, but it does reiterate you actually do need to make sure that these policies are being followed, especially in the those common areas. And one of the things that we've seen a number of clients do so far is sort of utilize those reservable workstation type tools. And since there's no incremental cost to them in the system, they have used those as a way to kind of give locations within a common room, or at least capacity within a common room that can be reserved into. So for instance, an employee could reserve a half-hour or 1 hour slot in the cafeteria at one of these locations. Now, whether or not it reflect back to that specific location may be up to the organization itself, but it at least allows for a sort of a non-hall monitor based automated approach that people can use to kind of maintain that distancing and maintain that capacity limits without being a little bit overbearing, and making sure that there's always a record showing here's how many people are there and we didn't exceed that capacity. And so you can see here we've got information on the flow around the room, so kind of one-way flow, clockwise, recycling, hand sanitizer, all of those types of things. So it'd be a very easy to read, convenient piece of information to be able to post next to that cafeteria, in addition to people having that available to them on their mobile devices. So I think, Eric, is this?
Yeah, so this is another major component of, I think, really any effective exposure control plan, but in Virginia in particular, this is an element of the new emergency temporary standard. There's an expectation of some level of screening, whether this is a screening that the employer undertakes directly at the workplace or a screening that is done by employees themselves at home before reporting to work. This has been identified as an important and effective part of the overall response employers should be taking to identify, isolate, and remove potentially infected workers or other visitors from the workplace. And that is to screen individuals who would enter the workplace for symptoms of COVID-19. This is a really interesting concept because by and large, this sort of activity, either conducting a physical, medical screening type activity like taking employees' temperature or asking employees about symptoms, asking employees about their own health and health symptoms like their body temperature if they've taken the temperature themselves, or whether they're experiencing any of the symptoms of COVID-19 would historically be unlawful. Under the Americans with Disabilities Act, you are not allowed to solicit that kind of information or make employees submit to medical evaluations like that to enter the workplace or to continue to be employed. But because this is a global pandemic, it is recognized the transmission of COVID-19 in the workplace is a direct threat to the workplace. So the EEOC and OSHA have said that under the ADA and any other privacy rights that might exist, employers are permitted, and now with rules like VOSH is implemented, like Michigan OSHA has with a governor's order, and other states have with either executive orders or health department mandates, are that you must be implementing some form of pre-work health screening exercise. We have worked with employers across different industries and different circumstances to evaluate where, how to, and who will conduct the screening, whether it makes sense to have employees do it themselves. If there is concern that employees will not be forthcoming or will not follow through on that requirement, often that's because there's not a paid leave benefit for reporting symptoms and staying out of work. So consider those types of policies as well for an effective infection control strategy. But if you have doubts that it's being implemented by employees and there's a need to do it directly at the workplace, think about where and who is going to be your temperature taker and who's going to be your screener. We found most effectively that that can be done outside the workplace, maybe even before the employee gets out of their vehicle, right? Driving into the company parking lot at a tent or kiosk where the employee can roll down the window just by an inch or two, and someone with proper PPE and a non-contact thermometer can take the temperature with the added benefit of exposure control from the barrier of the vehicle itself, a window that's only down an inch or two, employee standing back with a non-contact thermometer. That also has the benefit of not having a sick employee, a potentially contagious employee, entering the workplace even a few feet into the entrance of the workplace, and not having to stand in line near other employees coming in at the same time to be screened. And then, of course, think about what types of protective equipment is required for the temperature taker. That's the one task very likely in your workplace where the PPE is going to look a little bit more like a very high risk worker in a hospital setting might be wearing. One thing to think about with the pre-shift health screenings are the potential record preservation requirements. If you are collecting data, actual temperature data from employees, symptom-based data from employees, there is likely a requirement under the Americans with Disabilities Act for that to be kept for at least 1 year in a confidential manner. And there is a possible trigger of OSHA's 1910-1020, the Access to Employee Medical Records standard that would require you to keep the data for the duration of the employee's employment plus 30 years. That is triggered by a medical professional actually performing the testing, taking the temperatures, and making the record. So if you are engaging with a third-party medical provider or having a company nurse or somebody with a medical credential doing the temperature taking and making these records, you could be triggering very onerous record retention requirements. But if the employee is doing the screening themselves and sharing the information with you, or just doing the screening and verifying that they are safe to enter, and you're not actually collecting any actual employee medical information, you would not be triggering the OSHA data record preservation requirement. You may still trigger the ADA requirement, even if the employee is doing it themselves, if you take custody of the data. So think about those considerations, but how you implement this, in a somewhat automated fashion. I'm going to let Nick talk a little bit about some of the tools they've put in place to help employers implement that.
Sure. And so we've actually developed a pre-screen tool. So this is essentially a set of survey questions that would be distributed out to employees on a daily basis before they get to their workplace. And these would be distributed either through email or through text message links, or both. And employees would receive them basically based on their scheduled appearance into the workplace. So if they were on a staggered shift, basically, are they scheduled to be in during a given day? Have they made a reservation into a seat or a room? If so, they receive one automatically, or you can or you can just simply have them sent out manually on an as-needed basis. It's fully customizable. We don't see it here, but there is a symptom list check. So basically, it asks, has the employee experienced any of a list of, by default, the CDC standard symptoms? We have the temperature check and confirmation. So an employee could, at the option of the employer, be required to submit information on their current temperature before entering the workplace, and they have to confirm that before moving forward, along with a set of customizable questions regarding potential exposure risks. So, has any of their family members tested positive? Have they been in a hot spot? I mean, any of those types of questions, and those are all, excuse me, customizable as well. Also, the temperature check has the ability to customize what threshold a organization is going to be using to determine whether or not someone is able to enter the office, since that threshold's a little up to debate. And so, person gets through the surveys. They actually have to do an attestation that their information is accurate to their knowledge. They do an e-signature and get a confirmation from that. Based on the responses, they get routed one of two ways. Either if they responded in a way that shows that they're at an unacceptable risk of having COVID-19, or have experienced symptoms, or in a certain risk category, it would direct them either to reach out to HR or to follow certain policies that could be implemented in the system. Secondly, if the employee makes it through and is determined not to be a significant risk, they get that last screen there, which is set up to be able to be allowed as a kind of an entry key into an office. So, nice big checkbox, big name. You can flash it to security or reception or whoever is sort of controlling access to the office, and it provides a only active for the day set of proof that you have completed that survey and that you're cleared to enter an office. And so we do store these records for at least a year. They are all heavily password protected and permission restricted to administrative users. So not just managers or other employees. So we do have all the security precautions in place to make sure that these records are confidential and they are stored in their completeness for the duration. We do track pretty much every step of the process, every part of the answer. So if anything were to ever need to be pulled up to say what was a person's response, or what happened at this time frame, those records are always available.
So the next big component of any effective infection control plan and a requirement of the VOSH standard is a focus on sanitizing and disinfecting, cleaning of the workplace in those areas where there's a potential for exposure from surface to person types of contacts and transmission of the virus. So the concept is to evaluate your workplace, identify those common areas, common touch points, common equipment, things like that, where there is a possibility of one worker or a visitor, a third party, contaminating a surface that would then be touched by another worker or third party, and making sure that on a regular and frequent basis that you are decontaminating, disinfecting those work areas using the proper products, EPA approved cleaning products that do kill the coronavirus, and thinking about where to clean, how often to clean, and developing those cleaning strategies like schedules, like checklists, like logs to be able to keep track that it is being done, is a big part of effective infection control, and another area where Maptician's tool can help manage that process in the workplace.
And I know we're running a little short on time here, but just quickly on this area, we have those points of interest primarily as our solution for establishing the disinfecting and sanitization plans. So either blocking off areas completely, setting up the points of interest, which indicate either a cleaning schedule or a to be cleaned status, and then really the next item is if someone does test positive, the regulation says that the areas where they would have been present need to be closed off until they can be thoroughly cleaned, or they need to be closed off for a certain duration, after which they're presumed to no longer be infectious. And they even say that for the cleaning crews, it's recommended that they not enter the area. I think it's within 24 hours of the positive testing person being there. So it's a pretty significant requirement, or at least guidance, to respond and mark off an area as sort of a no-go area if someone's tested positive.
Yeah, another big area, totally non-controversial area in this country right now, is wearing face coverings. Strangely has become highly political and highly controversial, but this is an element of, really every, expected exposure control strategy, from governor's executive orders to health department orders to OSHA and CDC recommendations and guidance and enforcement that we're already seeing around the country, is a requirement to have employees in at least cloth face coverings in those areas where breakdown of that social distancing or physical distancing is required or is anticipated. And in those circumstances, something of a non-respirator face covering will be expected and will be required, and I think is enforceable. OSHA has expressed that it will be enforcing this under the general duty clause. We've already seen citations around this topic in Michigan, and I know that they're coming in California as well, because they give some advance warning of serious citations that are coming. We've seen this being enforced around the country. There is an expectation wherever it cannot be ensured that you will have social distancing or physical distancing, where that cannot be guaranteed, there's an expectation of some form of face covering or respirator. And so what can Maptician do to help out with that strategy?
Sure, and very similar to the cleaning approach, we tend to rely on the points of interest to indicate either areas where masks are required, based on either the density or the nature, common rooms, thoroughfares, with elevators, stairways, restrooms, things like that. Private offices are typically, I think, in most environments, considered able to be mask-free, at least if they're not being shared or occupied by more than one person. So we have the points of interest to be able to communicate both the policies and sort of the mask distribution stations, as well as once again the bulletin system to be able to provide contextual information to employees as to perhaps what those policies are and how they vary office to office or department to. I guess probably rather than department, perhaps a job task group to job task group, because that's probably the more important distinction in this situation.
So the last big thing, and I did want to make sure we were able to spend some time on this, because I know that this is an issue that that I know Maptician's tool has been very helpful for some of my clients already. And that is managing the process of what to do after there is a confirmed case in the workplace. And, it's an important part of an infection control, right? We call it the infection control and response plan is what we've been developing for our clients. This is the response plan piece of this, what to do. So you're not just in a panic. You've actually thought about it. How do we deal with confirmed cases in the workplace? Obviously, the first step is to isolate and remove infected employees from the workplace. Advising those workers to seek medical treatment and to self-quarantine or self-isolate. And then to address deep cleaning, disinfecting those areas where the employee may have worked, common or surfaces they may have touched, equipment that they may have utilized that remains in the workplace. Make sure you're isolating that, cleaning it before you allow employees to work in that area. And then you engage in this contact tracing process. And it's interesting, the Virginia rule technically says Our rule does not require contact tracing because the health department will be the one that engages in the proper formal contact tracing, but there is some element of contact tracing that I think is essentially required by the rule, and it is recommended and required in other jurisdictions. And that is because there is a major component of the VOSH rule and what we are seeing popping up all over the country now in some of these notification and reporting requirements to health departments, to state OSH programs, to OSHA, et cetera, and also to your own employees, to other employers who have employees in the workplace, to building owners or tenants, if you are the landlord or building owner, that you need to identify anyone who may have had close contact or whatever level of contact is triggered by the notification requirement with the infected employee. And one of the remarkable things about the VOSH rule is this extraordinary short turnaround that you are required within 24 hours of learning about a possible exposure. You are required to notify your employees who may have been exposed to a confirmed case within 24 hours, and required to notify VOSH within 24 hours of learning that 3 or more employees who had been in the workplace in a 14-day period have also tested positive in a 14-day period. This is VOSH's concept of an outbreak. You need to notify VOSH within 24 hours of learning about that circumstance, notifying other employers whose employees may have been exposed within 24 hours, and notifying the Virginia Department of Health within 24 hours of learning of any positive case of your employee. So these triggers for notifications to agencies, to other employees, to other employers happen very fast, and it requires you to do some assessment and to have some knowledge at your fingertips of who is this class of individual who is potentially exposed to that infected employee that I now have a duty to make a notification to. How do you do that? Manually, it's a very difficult task. I've seen employers struggle with this since the beginning of the pandemic, and now with this tight 24-hour deadline in Virginia and in other states with similar requirements. This is an area in particular where I think having a tool like Maptician offers has been very helpful already to some of my clients, and is something to take a look at.
All right. Now we're back in the Maptician application, and we'll go to something of an administrative dashboard. And so part of what I've been saying over the last hour has been talking about different records that are getting created within the system in terms of either the scheduled seating where people are coming in and out on a kind of a known recurring basis, or they have permanent seats and they either maybe have a private office or were already distanced enough, but either case they are expected to have been in the office or potentially have been in the office every workday for a period of time, or if someone has been using the some of the reservable resources. That may be the reservable workstations or reservable common rooms, meeting rooms, conference rooms, items like that. Or as we had talked about before, some of the break room type approaches to say, let me reserve this seat in the cafeteria or break room for some short amount of time to have lunch or have a cup of coffee. So each time one of those things happens, it creates a record in the system, and it creates a record in a location and a time frame. And based off of essentially the intersection of all that data, we are able to essentially take any given employee, and let's kind of go back to our Ava Lopez example, just because we remember where she was and kind of that there were people around her coming in and out on a kind of an ongoing basis. So if we say here that Ava did end up testing positive and the organization was notified either through kind of the health organization or by Ava herself, we would be able to start that, not necessarily contact tracing in the everyone's getting a call and going through kind of a very, very detailed approach there, but at least a potential contact tracing to say who could have been exposed based off of some of these criteria. And so other than the I guess, testing positive person, the trace target, the next big item to say is, okay, what's the date range? And the Virginia statute or Virginia regulation says it's a 14-day look-back period from the date of positive test. And that's actually the standard look-back in the system here. And so basically what we're doing is saying, over the past 14 days, who had been in the office that, their office time overlapped both in, dates and timeframes within the day, and kind of the third criteria, which is the scope. So depending on the size of the workplace or the nature of the work, we can take some different type of scope approaches. So the broadest could say simply who was at the work site at any time that overlapped with Ava here. So who was at the office at the same time, regardless of whether or not they worked on the same floor or on the same side of the building or anything like that. Just simply, were they in the same general address at the same time? So that's very broad. You can take it a step narrower and say just within a floor plan, which is typically a floor or a suite or some defined area of a different type of workplace, and kind of assuming that people more or less would stay around their zone like that, looking to say who would have been sort of similarly in that same place at the same time as the person who tested positive. And so as we start decreasing the scope here, we're narrowing down the list to what are probably more and more likely candidates for exposure. And this has a bit of a dual benefit. From one, it makes the contacting job easier. If you have 500 people at a workplace, that's a pretty significant effort to notify each one of them, either by email or a phone call. But if you're able to narrow it down to say 50 based off of which suite someone worked in, you're able to decrease that burden as well as make that notification mean something a little bit more. So if each one of your 500 coworkers got that notification, and because of privacy requirements, they can't know who tested positive, they're going to have a tougher time taking it seriously, just because it becomes a lot less immediate, because it's kind of that shotgun blast approach to notification. And so no one really knows, hey, did I have actual contact with this person? Or is this someone who was not even in the same office at the same time? So as you're able to narrow it down, it increases its effectiveness and it decreases the burden. So the third level of scope is distance-based. So rather than just looking at the suite, you can actually take where the person was. Now, it could be a conference room, it could be reservable seats, it could be anything, and it takes each one individually and accounts for all of them at the same time. But you can set a sort of a circular radius around each one of those events and say, during that time frame, who was also in that area, and give me their information. So once we've set these parameters, it's as simple as running this contact trace. And as you can see, we arrive at a list of employees or contractors, as it may be. And you'll probably notice pretty quickly that we've got multiple entries with the same person. And so what we're actually doing here is breaking down the potential contacts into individual risk events. So here we have Thursday, August 27th, and here we have Tuesday, September 8th. So those would be two times when this person and Ava would have been at the office at the same time, and they would have been situated within roughly 20 feet of one another. And so since we're automatically sorting by that distance, Carl is probably the priority number one as far as contact. And one of the interesting things that you can also do is take this list and get a little bit more information as to what was actually going on. So talking about the time-based maps, we can go in here and say August 27th. Let's kind of see how everything looked. And so here we are now in sort of back in time mode, August 27th. Ava was diagnosed, or this would have been within Ava's look back period. And you can see right across the hallway there, Carl was in a non-enclosed office space that his social distancing ring would have been just outside her doorway. So we know that this is a very legitimate potential source of infection. So you can run this through any of the individuals found by the trace and get a little bit additional context. Now, from the 24-hour period of, hey, we need to notify these people, and just absolutely making sure that you meet that requirement, we have the ability to export this to CSV, to clipboard, to PDF, and this includes, if it's available in the system, people's cell number, office phone, and email address. So it starts off as something of a to-call list, and by default also one that is prioritized by distance. So the goal here is not just to comply with the regulation, but also to make sure that the compliance is meaningful from a infection control and notifications standpoint as well. All right. And I think this is mostly what we had just talked about in terms of some of the features of the contact tracing. And it's probably worth noting that just from a privacy standpoint, we don't store the targets of those traces. So we never, to that degree, store this individual has tested positive. It's basically an administrative function that can be run on demand. And so there's not necessarily quite the privacy concerns of other employees getting access to that data, or knowing who has been reported as testing positive, since that information is never logged in the system.
Well, I think we've come to the end of our substantive slides today, and I think we've kept everybody for a good chunk of time. We appreciate that. I think what we can do is address questions. If you have any additional questions, please add them into the chat function. We tried to address a couple during the program, just sort of worked it into the ordinary presentation that we've already received. If you have others, put them in here, and we're happy to respond in writing or with a phone call after today's program. And of course, if you have any questions, either for Conn, Maciel, Carey about OSHA or VOSH or any other regulatory issues, please don't hesitate to reach out or check on our website. We have a lot of great resources that may answer those questions, including a COVID-19 frequently asked questions guide for employers that now is like a 100-page long manuscript, broken down by different categories and subjects. You can check that out. We also have COVID-19 record keeping and reporting flow charts and work relatedness questionnaires, and tons of articles on our OSHA and employment blogs about COVID-19 issues on the next slide. And then, I'm sure that if you track down Nick or visit Maptician's website, you'd be able to get a demo and some discussion about how some of those tools might be customized in your workplace if you have interest in that. We really appreciate everybody joining us today. I think this has been a really interesting discussion. We focus, always on sort of the regulatory component, and I've enjoyed over the last several months seeing how tools like this have been used in workplaces to take a regulatory requirement and make it work on a practical scale from an operations standpoint, and relieve some of the burden of doing things manually, doing things by, gut instinct or feel, or by combing through a bunch of records. It's been useful for some of my clients. So I was happy to be able to make that introduction today. Appreciate everyone's time. If you have any other questions, please let us know, and please don't hesitate to reach out. And thanks again, and stay safe out there.
Yeah. Thank you, everyone.